This presentation provides information about the WFOT Global Strategy for the Occupational Therapy Workforce and introduces initiatives of WFOT in relation to the strategy. The WFOT Global Strategy for the Occupational Therapy Workforce provides a framework for strengthening the workforce. The global strategy is relevant to anyone wishing to improve access to occupational therapy and is available from the WFOT website, with translations of the executive summary in multiple languages. A workforce development section on the WFOT website describes the global strategy and other WFOT workforce initiatives. A downloadable version of the global strategy report is available, in addition to a web-based description. Both the report and the web-based description provide a full explanation of the strategy, detailing the 7 strategic directions plus specific actions and task examples for each strategic direction. A workforce hub is also located in the WFOT Workforce Development website section. The Workforce Hub has been created as an interactive site that allows sharing of resources which are useful for occupational therapy workforce planning, development, and evaluation. Workforce issues concern the profession from many perspectives, and work is underway on many initiatives relevant to the workforce strategy across the world. Occupational therapists, occupational therapy organizations, educators, regulators, and researchers, as well as workforce planners are invited to share resources on the Workforce Hub, such as reports, studies, and other tools. By sharing such resources, others can benefit from the work and see how they too can implement planning, development, and evaluation tools to address workforce issues they are facing. When making a submission to the Workforce Hub, you are asked to assign the resource to one or more of the 7 strategic priorities of the global strategy. The first strategic direction involves the strengthening of occupational therapy workforce data. Knowing the status of the occupational therapy workforce is required to identify needs and monitor workforce development over time. Famous quotes from management guru Peter Drucker emphasize the importance of such data, such as, "If you can't measure it, you can't manage it," and "What gets measured, gets improved." The second strategic direction involves aligning occupational therapy workforce data with population health needs and health systems demands for determining supply shortages. Having identified supply shortages, the third strategic direction involves investment and technical support for expanding education and developing local capacity for workforce growth. Improving workforce supply is generally not enough, however. Inequities exist in the distribution of occupational therapists and population access to occupational therapy services, most commonly defined by factors such as geographic region, urban, rural or remote location, and sector, service, or practice area. The fourth strategic direction therefore involves actions such as recruitment and retention benefits, innovative service delivery models, and outreach programs to improve workforce distribution for improving equitable access to occupational therapy. As well as improving availability and accessibility of occupational therapists, workforce planning must ensure requirements are met for workforce competency, engagement, and diversity, the fifth strategic direction. The sixth strategic direction involves fostering development and use of workforce research to inform policy and management. Actions include developing workforce research structures, networks, and agendas to generate needed evidence, and systematically using evidence to inform and evaluate policies, planning, regulation, and management practices. Lastly, the seventh strategic direction involves building workforce leadership and planning capacity. This requires developing current and future professional leaders at the local, national, and international level to serve as advocates and participants in broader health workforce policy and planning. In addition to creating a global hub for strengthening the occupational therapy workforce, WFOT has plans for a number of initiatives to implement the global workforce strategy. Our current plans include developing an international framework of occupational therapy workforce data, together with tools to enable reliable collection. Tracking engagement, creating workforce strategy implementation, sharing opportunities at the WFOT Congress, and continually updating the scoping review. Advocating for occupational therapy, particularly around classification and recognition at an international and national level. Addressing health workforce priorities stated in the WFOT collaboration plan with WHO. And lastly, supporting leadership for building the occupational therapy workforce and devoting resources and assigning responsibilities within WFOT to enable leadership in workforce development. Thank you for watching this video. Contact us at admin@wfot.org if you have any questions.